Suturing is actually a skill that was recently added to the athletic trainer's scope of practice, and although for the most part team physicians are going to be available to help suture, it's always good to know as an athletic trainer a new and adapting skills for us to use in our clinical practice. Not all lacerations require sutures, such as this one, but larger lacerations such as this one will require suturing, and it all depends on the depth of the laceration. In order to fully prepare to suture a laceration, we need to have an entire suturing kit. Now this kit is just for practice purposes, but it is pretty close to the actual suture kit that you will be using. In your suture kit, you should make sure to have a suture driver, forceps, scissors, sutures, and sterile gloves. Now, for this video, I do not have sterile gloves, but for the purposes of demonstration, these are the gloves that I will be using. Once you have your gloves on, you want to just double check to make sure that you have the correct sutures for the procedure. For this video, I will be using 4L nylon sutures. I begin by grabbing my tools and then I position the patient, which is a banana in this case. I position it properly so that I can get ready for those sutures. So I grab the needle and I use my suture driver to grab a hold of the needle, and then I squeeze them together until I hear the click. I did position the needle through the needle driver at about 90 degrees just so that it gives me a better angle when I thread it through the patient's skin. Then I grab the forceps and I'm going to gently lift up the skin and then use my suture driver to thread through the first part of the skin on the first half of the suture, on the first half of the laceration. And the type of forceps that I'm using is called the Adson pickup. So the type of teeth that it has on the end of the prongs is actually meant for skin. Then I'm going to lift up the other side of the laceration carefully, and I'm going to drive the needle through that part of the skin. Then once it gets through to the other end, I'm going to use my needle driver and pull the suture all the way through until I have just a little bit of suture left as I pull it through. So you want just a little bit of the suture to be hanging out on the other side of the laceration so that it's just enough for when we do our tie. So if you notice, I wrap the suture around my needle driver 3 times, and then I reach through to get that small part of the suture on the other end, and I grabbed it and then I pulled through, and here I am tightening. Now, I do not recommend tightening it manually with your hands. However, the needle driver unfortunately does not have a good grip for the suturing, so just make sure that before you begin your procedure you have the correct instruments and tools, or else you will be struggling to try to do the ties manually. The first time you do your suture tie, you want to wrap it around 2 to 3 times. Then the last 2 times that you do the tie, you only want to wrap it around your needle driver 1 time. Once you have an adequate amount of ties, you can pull through tightly, and then you're going to collect the rest of the sutures and you're going to cut it relatively close to the laceration, but not too short because we don't want to undo the suture. I'm going to speed through the rest of the sutures since we already know how to do the technique, and then I will continue once we get to that last suture to see how we finish up the sutures. One thing I do want to note is that since my needle driver doesn't have good grip on the sutures, I wasn't able to pull tightly to fully close the wound. So again, just make sure that your tools are fully functioning prior to suturing, because again, we do want to fully close the wound and not leave any open gaps. Then here I am placing the last suture on the laceration. Now, realistically speaking, I would have put one more suture after this one to fully close the laceration. However, I am running out of sutures, so for the video, I do have to let this be the last suture, but I would, in theory, close up the entire laceration so that the wound has full closure. Keep the wound clean. We're going to use a transparent semi-permeable dressing so that it just keeps it away from any debris or anything that could possibly get it infected. Then on this next laceration, I challenged myself by putting it in a pretty tough position. It's like right on the edge of the banana and it's on the curve of the banana, so holding it sturdy so that I can get through the sutures was really tough. But you have to remember that your patients are not always going to have the perfect lacerations. They're not always going to be in the perfect spot. So when you practice your sutures, I highly recommend practicing them in some pretty challenging positions and different patterns of lacerations, because again, in the real world, nothing is textbook. For both lacerations, I actually used the same technique. It's called the simple interrupted stitch. And so this is a suturing technique that is actually fairly common, and it's known as the interrupted stitch because the individual stitches are being applied to the laceration, but they're not connected, they're all separate. And then again, just be sure to cover your wound because you don't want any debris or anything like any dirt getting inside of your wound. So here I am just using that transparent semi-permeable dressing again. Then once you have it properly covered, just don't forget to educate your patient on proper wound care so they keep it nice and clean.